Hi, everyone. I'm Jay Watson with Emory Brain Health Center, and I'm joined now by pandemic expert Dr. Carlos Del Rio, Executive Associate Dean of Emory University School of Medicine at Grady Health System and Professor of Medicine, Global Health, and Epidemiology. Welcome, Dr. Del Rio. It's good to see you again.
Always happy to be with you.
A lot to talk about, and as I feel like a broken record, I say the same thing every week. A lot has changed since last week. And so the first question we're going to begin with today that came to us is, who should get an antibody test and how can they?
Right, we weren't talking about that last week, right? And now the new news is we have an antibody test.
Yeah.
So there's several types of antibody tests, and I think part of the problem is not all antibody tests are created equal, and I think we need to tell that to people. And the FDA is just approving a lot of them, and really we need to decide which one is the good one. I'm going to first start mentioning one that was developed here at Emory because it was a tremendous example of how basic research is important, and basic research gets translated to the bedside, to the clinical, to the patient. So investigators at the Emory Vaccine Center at Yerkes, working with the virus, were able to develop an antibody, characterize a molecule that was part of the virus, which is highly conserved. And then they were able to take that to the clinical laboratory and develop a test that now the clinical laboratory scientists have turned into a test that they can now use in practice. And these are called laboratory developed tests. That's lingo for saying it's not a commercial test, but it's something that was developed in-house. But it's a really good way of how science in a place like Emory can go from the bench to the bedside in a very short period of time. So we're very excited about those tests. So what are those tests good for? Well, they're good for many things. Number one, they're good to make a diagnosis. Some of them are good for diagnosis. Now, your antibody test doesn't turn positive immediately. It takes about 4 to 5 days after infection to turn positive. But if so immediately after infection, it's not going to be positive, or a day or 2 or 3 later. In those days, there's the other test, the typical flu test that you put up somebody's nose and you look for the virus. But the blood test, about 4 days, is going to turn positive. But then it's going to remain positive for a long period of time. We don't know how long, but we estimate that at least a year, maybe 2 years, it will remain positive. So it will help you know if you had the infection. And why is that important? Because, I may be sitting here saying, oh my God, I'm at risk of coronavirus. But if I can get a blood test and says, no, actually back in February when you had a bad cold, that wasn't a cold, that was coronavirus, and you just didn't know it back then, maybe it'll make me feel better than, okay, I already had it. I don't need to be as concerned as if I never had it before. And so it will allow us, from a public health perspective, also to start doing more testing and really try to figure out what percentage of the population out there is infected, which is something we really don't know.
And wouldn't that go towards the whole getting people back to work if you know you've had it and you supposedly have immunity, being so-called safe, I guess, to go back out into the world again?
Yes, but just a word of caution. Depends on the antibody test you're using. Not every antibody test is going to tell you whether you have immunity. We don't really know what immunity is necessary for this virus, but we think it's probably an antibody to a very conserved region of the spike protein. That's a protein that attaches to the cells in the respiratory tract. And we think an antibody to that protein is actually immunogenic and protective. So you need an antibody test that actually is showing that. Other antibody tests may just show you've been exposed, but not necessarily immune. But it's still an important step. And yes, part of how do we reopen the country? Because I don't think we're going to get back to normal the way we knew normal anytime soon. But how do we start getting out of this situation we're in? How do we get out of this box we're in? And the antibody test is one of the many components necessary in order to do that.
Well, that brings us to question 2. If you were in charge of the country, and I do think that you got this question maybe 3 weeks ago, but 3 weeks ago is like a year ago now. If you were in charge of the country, when would you reopen the country and how would you do it?
So the country is a very big country. The United States is a very diverse country with a lot of different situations. And you could be in New York City, a place I wouldn't open anytime soon. In fact, Governor Cuomo right now at a new press conference a couple of minutes ago said, we will remain and shut down until at least May the 15th. So New York City is heavily impacted. You will do something very different there than what you may do in Wyoming or even in Texas, where the infection rate is lower and where there's a lot more spread of population. California has definitely a very different plan because they implemented, restrictions earlier and they have a much less impact of the epidemic. So every part of the country is going to be a little different. So in a way, the president needs to let the governors and needs to let the local people actually make the decisions, because the decisions have to be local. And even at a local scene, I can think, you may do certain things in certain parts of Atlanta that you wouldn't do in other parts of Atlanta. So really, or certain industries may do something very different in other industries. So I think this really requires a lot of thinking, a lot of local thinking, and a lot of expertise and continuous feedback to make sure we're actually doing the right thing.
I saw that you tweeted a study a few days ago about how long we'll be doing social distancing. And I got a question today that fits with that says it's been reported we will not be the same again as a country until 2022. Do you agree?
Okay, so that's from the study of Mark Lipschitz, which is it's a wicked smart guy, epidemiologist at Harvard, and his group is very good at looking at this. He is the one suggesting, until we have a vaccine, we're really not going to get out of where we are right now. He may be right, but we cannot continue doing what we're doing until 2022. So we have to think creative ways of getting out of this, and that may be we may need to wear a mask for a long period of time. We may need to see who's infected and who hasn't. We may need to think about, there may be antivirals being developed in the meantime. So we may go back to a normal in which you're diagnosed and you start an antiviral right away. So I think things will change. I don't think we're going to be in this position until 2022, like the study suggests. But clearly, we're not going to be back to where we were only a few months ago. I think it's going to take some time to get there. But my challenge to everybody in the U.S. and my challenge to the president, to everybody, is I don't want to go back to where we were. I want to go forward to a better America. I want to go forward to a better place. I think we learned in this epidemic a significant impact in African Americans. I think we learned the impact of health disparities. We've seen health disparities in this country for a long, long time. Maybe it's time that we use COVID to address health disparities, and actually we go to a better place. We get to a better America, much that is an America that is more equal, an America that gives better opportunities to people, and that really works together in trying to control an infectious disease like this one.
If someone has been in their house for 3 weeks now, there is no chance of them getting it, right?
Pretty much no. I don't see why they would be getting it.
Why has the peak date in Atlanta been pushed back? When will it be now?
So that actually is good, because what pushing the peak date back, what that means is that we're flattening the curve. And remember, we use that expression, flattening the curve. So if you hadn't done anything, you would have seen a huge peak of infections. And what happens when you have a huge peak of infections very rapidly is you overwhelm your hospitals, you overwhelm your emergency rooms, you overwhelm your ICUs, and then you run into trouble, because all of a sudden you have 300 patients and only 200 ICU beds. So you have to decide who you're going to put in the ICU, who you're not going to put in the ICU. Mm-hmm. By flattening the curve, what you're doing is you're making sure that the number of patients coming in is smaller. It's going to be over a longer period of time, but that actually is good, because then you don't overwhelm your ICUs, you don't overwhelm your ventilator capacity, and therefore you're not making those difficult decisions that we all dread that we may need to do if we have an overwhelming situation. So pushing the peak date back is actually not bad. But again, I don't really like the term peak, because, this is like people say, oh, we got to the peak, we're done. Well, think about going to a mountain. You wouldn't go up to Mount Everest and say, oh, I got to the peak, I'm done. It's just as dangerous coming down as it is dangerous going up. You have to realize that once you get to the peak, you're still not out of trouble. There's still going to be deaths. There's still going to be problems. And therefore, the peak is not that magical moment. It's just simply an epidemiological term in which we start to see new infections really start coming down. And that, I think, is something we're all going to be very happy about.
Yeah, and that's a very good point. With infections reported at meatpacking facilities, should we as consumers be concerned about buying and eating meat? We are getting this question from several people.
No, there's no concern, but I feel bad for people that work in meatpacking facilities, because actually it is the crowding, it is working closer together that is actually causing this kind of infections. And there was a big outbreak, if I recall, hearing on a meatpacking facility in the Dakotas that actually did pork and other things. So no, I feel bad for those workers and for their families and for the infection that is causing, but it's because of again, infection control issues in many of those facilities.
I work in a private school and we run day camps. We're talking about our summer programs virtual. Do you think there's any hope of doing in-person camps in July? The planning has been beyond stressful.
July of which year?
This year. Summer
No,
camps for kids in July of this year.
I think it's going to be very complicated unless you can figure out a way to do a summer camp with kids that are 6 feet apart. But maybe there's a way. I was just reading a couple minutes ago before we started, Emirates Airlines is actually testing every passenger right before they're board a flight out of Dubai. So, maybe we can start testing every kid before they go to camp. And instead of day camp, we do overnight camping, which all the kids are tested and all the counselors are tested. And we put them in a, sort of a quarantine camp for 2 weeks or 3 weeks, and maybe there could be something. So I'm not going to say that it's impossible, but we need to get very creative.
What I'm hearing you say also is that we're still going to be social distancing in July.
I think we're going to be doing some sort of social distancing. I mean, we may need to be wearing a mask. We may need to be doing, certainly not attending big events, certainly not attending, having our vulnerable populations, people over 65, people with diabetes, with heart disease, going to any of those events. So I think again, we're in for several months of not normal life.
I know a number of people who've not been tested but are presumed positive by their doctor because of symptoms and exposure. Are those people counted in the reported confirmed cases?
They're not in the number of confirmed cases. That is correct.
We are being told to improvise masks. What's the minimum that actually serves the purpose? I guess they mean the minimum to put on your face.
So you have to cover your mouth and your nose. I would encourage people to watch, and we can link it later. There's a video that Sanjay Gupta did in CNN, which is fantastic, about how to make your mask at home. It was really nicely done because you don't even need a sewing machine. You just need a bandana, and he shows you how to bend it and how to put some hair things on it and how you put it on. But, this is a very simple mask that I have here, and this would be a good mask to use if you're going outside. This would be a reasonable mask to use if you're going outside. But again, you remind people that the mask that I use for going outside is not to protect me, but it's actually to protect others. And let me explain why that is the case.
Okay.
One of the things we've learned, and we're pretty certain now, is not only that there's asymptomatic or pre-symptomatic transmission. We now know from a recent study that about 2 to 3 days before you develop symptoms, you're highly infectious. And in fact, some of the studies suggest that maybe up to 40 to 50% of transmissions occur during those 2 days before you develop symptoms. So you may be sitting here and feeling fine, but you're already transmitting. So the idea of having people wear a mask is so if you happen to be in that stage, by wearing a mask, you then don't transmit to others because your saliva and your secretions stay within the mask and they're not then shared with others. So by doing that, we can probably decrease asymptomatic transmission a significant amount. Now, the one important thing is that then you have to wash this mask because obviously the inside is going to be contaminated if you cough or you sneeze into it. And I would suggest that you treat this mask with a lot of care so you don't infect others in your household.
Okay, so I'm just asking this. When I go to the grocery store to make a quick run, rarely when I have to, it's at least half the people who are not wearing gloves or mask. Does the mask that I'm wearing give me some protection from those people if they are in the shedding the virus stage?
They don't. It doesn't. It will not give you any protection from those people. It will protect other people from you shedding. And that's why we all need to wear a mask. We're wearing a mask in public, not to protect ourselves, but to protect others. It's really for the protection of others that we have to wear a mask when we go to the grocery store.
Okay. Is it possible that there is no immunity to COVID-19? Are people recovering only to get reinfected?
From what we know of coronaviruses, that will be highly unlikely. There's going to be some degree of immunity. How much immunity? That's yet to be determined. But I suspect there will be significant immunity against this coronavirus, what we know about the structure of the virus.
Is it safe for me to take my 85-year-old aunt a casserole I made if I leave it at her doorstep?
Yeah, that's great.
What do you think the next steps should be?
That's
a broad question. That's the question. What do you think the next step should be in all of this?
Well, I still think we need a lot more testing, right? I mean, here in Georgia, we're 44 out of 50 states in testing. We have not scaled up testing the way we should. We're doing more testing, but we need to do way more testing. We need to make testing readily available, accessible to people, so we can act right away. We know from the dynamics of this virus that we need to be able to test people and act on it quickly. And what I mean by quickly is we need to track their contacts and isolate that person immediately. We cannot wait weeks and weeks for the result, because then it doesn't benefit. You cannot stop transmission. And by doing that, what you're trying to do is you're trying to bring, remember some weeks ago we talked about this number, the R naught, or the reproductive number of the virus. This virus has an R naught about 2.5 to 3. By doing social distancing and the things we're doing, you want to bring the R naught down. And Wuhan was able to bring the R naught down to 0.3. And when you get it to 0.3, you stop the epidemic and you're in good shape. New York, I heard from Governor Cuomo, has brought it down to 0.9. So they're in the right track, but they're not quite there yet. So we need to continue pressing on the social distancing so we actually decrease the number of infections. And then we have to be sure that we start preparing to begin opening certain parts of the economy, because we need to start reactivating them. And for that, we need to start doing some planning, some very serious planning of how we're going to do that. And I mean, certain things, let me give you an example. For example, a university or a school may decide, why don't we have, instead of one shift of students, 2 or 3 shifts of students, so we can actually put the students 6 feet apart, right? Mm-hmm. And we can actually, instead of having a classroom of 30, have a classroom of 10, 6 feet apart, so they can come to school, but we have 3 shifts. So we need to start getting creative and start thinking, how are we going to do what we used to do, but in a different way?
Well, that's our next question. Will our kids be able to go back to school or college come this fall, which is August for all of us?
I think they will, but again, they may not go to the way they used to go to school. And I think we need to think about that. I mean, it may be that, again, the classroom of 30 turns into 2 classrooms of 15, or the classes tend to be more outside, more separation, and you may be required to have a mask when you're in class, and there may be hand sanitizers everywhere in the school. And maybe if you're a professor who is 70 and or 65 and has diabetes, maybe you're not returned to school. I mean, it's going to be different. It's going to be challenging. It's going to be a lot of decision making is going to have to be made.
How long do you think immunity will last?
Again, I would be guessing, but again, from what we know from this kind of viruses, at least a year.
Is there any evidence of multiple strains circulating the country?
There's evidence of multiple strains coming from different places. But again, what I tell people is that multiple strains doesn't mean that you have multiple susceptibilities. Simply the virus has changed a little bit in this composition, but the overall characteristic of the virus remains the same. And I was telling somebody yesterday that the vaccine, for example, the vaccine that was developed by Moderna that we're testing here at Emory, it's a vaccine directed to a highly conserved portion of the spike protein. So it's a little bit like thinking about the key to a door, right? That key hasn't changed. The mutations you're talking about, the strains, is if somebody painted the door different colors, or maybe doors of different colors, but the key's still the same.
Mm-hmm. Why is Georgia's mortality rate from COVID higher than the average? Does that have to do with the health disparity?
We're looking at that. We're studying that. I think several possibilities. Number one is health disparities. Number two is higher prevalence of diabetes and hypertension. Remember, we're in the diabetes belt, right? There's a lot of diabetes in our population. So diabetes, hypertension, obesity may be more prevalent, which drives mortality. So again, this is the sort of the clashing of diabetes, hypertension with an infectious disease is being lived right now in our community.
Mm-hmm. Aren't there new cases coming out of Korea of people who've already had the virus getting it again? Have you heard this?
I've heard it, and there are a few cases, but I think we're going to expect that, but they're not having an epidemic. They're just having a few cases, and that's because the Koreans are incredibly good at testing, so they actually can pick those cases up. It doesn't go silently.
What percentage of the population needs to have developed antibodies before we develop herd immunity?
60%.
60%.
So a lot of the population.
Wow.
Let's say 50%. It's still 150 million Americans. I mean, it's not going to happen anytime soon.
In South Carolina, we are talking about opening up schools next month. What is a realistic time frame for schools opening up? I know you just talked about this a little bit, but should schools reopen before the end of this school year?
The answer, in my mind, is no.
What if you have a child with mild asthma?
I think anybody with lung problems has an increasing risk of having, complications. So, I think you want to protect each one of your children, but those with asthma even more.
Given the amount of pain, loss, and grief that COVID causes to human species in 21st century, can we expect global pressure on some kind of permanent measures to control wildlife trade? Can you talk a bit on the causes or implications of wildlife animal trade on outbreaks such as COVID-19?
So COVID-19 is the poster child of why we need to stop animal trade and why, One Health is important. And One Health is this concept that animal health, human health, and the environment are all interrelated. And if you go in history and you understand this live animal markets in China, they were authorized by the government. They were developed because of population growth, population explosion, and the need to feed people. So because of that need to feed a growing population, we developed something that has been a nidus of recombination of viruses and has caused outbreaks like SARS in the past and now COVID-19. So yes, I would think that there needs to be significant international pressure to A, stop those, close those wet markets, and B, to stop animal trade. Illegal animal trade clearly is a driver of many of the problems that we're seeing.
The music industry and touring musicians have taken a huge hit financially. Recently, an article was published stating that concerts and shows will not start again until 2022. Do you think it will take that long?
I'm not sure. I am in the board of directors of the Atlanta Symphony. I've been working with the symphony a significant amount, trying to figure what is going to happen next. We would love to have a season starting in September of next year, but I worry that Symphony Hall with 2,000 people may not be possible as soon as that, or maybe we're all going to be sitting there with our masks. I don't know. I mean, I think we need to figure out how that's going to happen. It's going to be different, and I'm not sure I know the answer, and I'm not sure I fully understand what the implications are. And again, I'm terribly sorry for the people like the music industry, like entertainments, like the sports arena, like the athletes, because they are taking a huge hit in their personal life, their financial life, and quite frankly, their art. And I would say that I'm also honored and just amazed by what some musicians are doing about getting their music online and doing things innovative ways of still reaching audiences and still reaching communities.
But I remember, I think it was last week, you said to me that you didn't know if you could see yourself going to a baseball game. That stuck with me too.
Yeah, no, I think you worry about it. You worry about you're going to have to make a decision. Is the benefit worth the risk in many of these events?
Can you talk about the psychological effects of COVID?
Well, I mean, I think you start mentioning them, right? It's anxiety, is loneliness, is depression, is many of the things that the next steps is we have to have the mental health support systems to take care of people, because we need to care mental health now. We can't wait for later.
What does this look like going forward? Will we be doing this seasonally after there is a vaccine? I've heard about it being like the seasonal flu going forward. So I'm curious what that looks like. Are we going to be good in the summer and then we get hit with a wave of it again during flu season and have to start again with school closures, social distancing, et cetera?
I don't like to try to predict that, because that's impossible to predict. I mean, I feel a little bit like I could be living in the Florida coast and, after hit by Hurricane Katrina, and say, what it would be like, I'm going to get another hurricane. Yeah, you probably are, but hopefully we're going to be better prepared, right? Hopefully we're going to have more testing, have new drugs. So it's not going to be the same. And again, if we have a vaccine, the flu vaccine we've had for a long time, and only 40% of the population uses the flu vaccine. So, what makes you think that people are going to accept the COVID vaccine and everybody's going to use it? There are going to be some people that are not going to take the vaccine, and there's going to be some people that are going to be at risk. So yes, when the new flu, COVID season starts, we may see some people still get sick with COVID because they didn't get vaccinated and they didn't do the things they needed to be doing.
It's like you're a mind reader, Dr. Del Rio, because you're talking about this as this question comes in that says, I see people say often, if they develop a vaccine, I'm going to wait a year after it becomes available to get it to make sure I don't get side effects. Is this a smart thing to do?
The smart thing to do is to develop the vaccine the right way. And that's why it's taking time, because you don't want to cut corners precisely to avoid damage, precisely to avoid injury, precisely to avoid problems. So when people say we want a vaccine now, we tell them, no, we need time to develop a vaccine correctly because you want a vaccine that is safe, that when it's out there, it's actually can be used appropriately.
How long do you have to wait before testing positive if you are with someone that is positive? The wording's a little off on that question. So how long do you have to wait? Yeah.
Depends what do you mean by being with somebody, right? I mean, let's suppose that
maybe let's say you're in the same house, right? If everybody's doing what they're supposed to
do. So it's different. If you're in the same house, that's a different story. That's what I was going to say. It depends what you mean by being with somebody. If you were in the same house, you probably should be tested right away because the reality is you're probably already infected if you are, and if you're not, you need to be isolated. That person needs to be isolated, and you need to not be in contact so you don't get infected. But, I've heard people say, well, I was at an office meeting with somebody, and what does that mean? Well, we're sitting at the same table, and we were there for a few minutes. That's not going to lead to infection. So I would say tell that person, monitor yourself, monitor your temperature, monitor your symptoms, and if you develop symptoms, then get tested. But there's no need to be tested right away. So we need to realize that this is not, as infectious as it is, this is not something that just, infects you just by passing by.
Do you think plasma therapy is effective?
Again, this is not an act of faith. This is an act of science. Do I think it could be effective? Yes. Do we need to test it? Absolutely. We need to do the studies to show it's effective. But I don't want to say, I think it's effective, because I don't know if it's effective. I think that the science behind it is sound and it's worth testing it.
Why is avoiding COVID-19 not able to be handled similar to avoiding the common flu? Why can't we just handle it the way we handle the flu?
Well, in a way, we are. We're handling as if we were handling a flu pandemic. This is a pandemic. It's very different than your regular flu, right? And if we were having today a flu pandemic, we would be doing exactly the same thing.
Are there any over-the-counter medicines that someone can take if they think they're in the beginning phases of developing COVID? Mucinex?
Nothing.
Yeah. While we wait for a vaccine to develop, if there was a proven treatment of COVID-19, would that allow us to eliminate social distancing and get back to something that resembles normal?
I think it will be one of the many things that will help us get to a normal. Yes. We need to develop those treatments. We need those treatments as much as we need a vaccine.
Emory announced 2 days ago that they were testing those already in the Emory healthcare system for COVID-19 antibodies. They never said you have to have symptoms to be tested. So amid this confusion, they listed 2 phone numbers and 2 emails, but there's no way to get information from anyone. There's not necessarily a question there, Dr. Del Rio. I don't know if you have anything to follow up with that.
I would need to see the announcement. I think we need to read it. I think sometimes, some press releases sometimes confuse people. I think this is probably the press release around the antibody test. And I think what it was saying is this is going to be used to test healthcare workers to see if they've been infected or not. Mm-hmm. That's what it's probably saying. Nothing more than that.
Please ask about likelihood of students being able to live in dorms.
I think, again, I don't know the answer to that. I think it's one of the many questions we have. If the students are positive and they already had this and they're okay, maybe you have dorms of people who are COVID, experienced versus dorms of people that are COVID negative. I don't know. We're going to have to figure out how to do this. Again, it's not going to be like in the past.
Right. Do you think Governor Kemp is handling this well?
I think the governor is doing a lot of things. He's doing a lot of very good things right now. I think he just made the decision to extend shelter in place for the state of Georgia until the end of this month. We'll see what happens over the next several days. But I would say overall, I'm pretty pleased with where we are.
Given the much larger numbers of flu deaths, why is it not considered a pandemic? What makes it a pandemic? Numbers or percentages or location or what?
So I think this gets into you mean the normal number of flu deaths that we hear about?
Mm-hmm.
So I think this is something that let me say something that is going to be pretty controversial maybe with some people, but I am a believer. I'm pretty convinced that the number of flu deaths that CDC reports, it's actually what they report are estimates. They do calculations of what they think is the number of flu deaths, but they're not measured they're not actually actual numbers. What we're measuring with COVID is actual number of deaths. And if you compare the actual number of deaths from flu last year, even this season, the actual number of flu deaths this season are in the neighborhood of about 7 to 8,000, right? So it's very different. The numbers are very different, and I think that's part of the problem that you have. The part of the problem is that we're trying to compare apples and oranges. We're trying to compare an estimated number, and if we calculate an estimated number of COVID deaths, I bet you the death rate will be much higher.
Okay. Are there any major barriers to the ability of researchers and experts to communicate and share research from across countries?
Absolutely not.
How much fever should a pregnant woman with a very mild dry cough be worried about?
100.8.
Do you anticipate that hospitals will open their doors to medical and nursing students anytime soon?
I'm not sure. Maybe sometime in the next couple of months, but not anytime soon.
Why are diabetics with controlled sugar levels still
And
more...
again, let me just say, talk about the issue of students. The issue of not allowing students is primarily because we have limited supplies of PPE, right? And if you have a ton of students, now you need to give them more PPE. So for the number of students is really about decreasing the number of people, of visitors inside the facility.
That's a good point. Why are diabetics with controlled sugar levels still more vulnerable to the virus?
We don't know. That's a really good question.
Is the clinical trial drug remdesivir working?
Well, that's why we're doing a clinical trial, because we need to know if it works. There's an observational study that was recently published of compassionate use showing some signal, some hints that it worked. But again, the ultimate, sort of the gold standard is a randomized clinical trial, and that's just happening right now. It's still not there.
Do you think the high mortality rate for influenza this year was complicated by undiagnosed COVID-19?
I don't know. It could be.
Let's see. If the virus were to become endemic seasonal, and given that vaccines aren't always 100% effective, should we expect people hospitalized or ill may be at risk of getting hospitalized more frequently?
I think, again, a lot of speculation on that question, right? I don't know the answer to that.
Dr. Del Rio, we're going to wrap up here soon, but from the questions that we see coming in, from the questions that people send me ahead of time, I feel like one of the main focuses, aside from the infectious nature of this and how long people have it, is when are we going to get back to normal?
No, I think we're all dying to get back to normal, right? I was telling somebody the other day, I sometimes have this wish that I would wake up one day and say, oh, this was all just a bad dream.
Yeah. Well, so we talked about this a little last week. I think it's in our very human nature to be very forward-looking or living in the past, right? Reliving arguments we had with people 3 days ago. But people right now are very forward-looking because not everyone loves where they are because they're home. A lot of people are very economically impacted by this in a horrible way. So they want to see glimmers of hope. So I'm going to put you on the spot. Tell me the good part in all this. Tell me the glimmers of hope. What are the good things that we're seeing?
Well, the glimmers of hope is that, number one, we are seeing benefits of social distancing, and we're seeing real benefits. More hospitalizations are less than expected in many cities, and mortality is coming down. I mean, in the country, if we hadn't done the things we were doing, we would have seen 1.8 to 2.2 million deaths. We're going to see 60 to 80,000 deaths. That is a huge difference. I mean, still 60 to 80,000 is a lot of deaths, but it's a lot less than 1.8 to 2.2 million. Number two, we're seeing people do things that we never thought it was possible, right? 90+% of the country is doing social distancing, and it's actually doing it without any police force like they did it in China. There's nobody, the police is not out there enforcing it, and people are doing the right thing. And I think that shows what citizenship is like. We're seeing enormous acts of kindness. I mean, I'm overwhelmed by the number of people that are sewing masks, that are sewing gowns, that are bringing coffee to and food to physicians and to nurses and to healthcare workers. The amount of acts of kindness that we're seeing is just overwhelming. I think we're also seeing what the benefits of science are. I mean, we discovered this disease late December. The virus was described early January. We now have tests. We have a vaccine. We have 70 vaccines being tried, 3 of them already in clinical trials in humans. We have multiple medications being tested. So science has really accelerated the way in which we can respond to this disease. Otherwise, you think without science, where would we be now? And I see as an enormous glimmer of hope the amount of international solidarity and of collaboration that we're seeing across scientists, across communities, across the country. I mean, to have people, go to New York to help out there, to have people, nurses in California willing to go, that they're not busy enough, willing to go to New York to help out. So the amount of solidarity and the amount of kindness that we're seeing, to me, are glimmers of who we really are and the humanity that actually is what we all live for. I'm seeing musicians do things, music online. I'm seeing artists. I'm seeing all sorts of different things happening. So the reality is that so much good is coming out. And I think at the end, good will defeat this virus.
May I ask a question about you?
Sure.
So I've felt this myself, but a lot of friends have talked about this, and we touched on it a little bit about feeling kind of a heaviness, not just with the uncertainty, but a heaviness maybe from the weight of this. Do you ever feel that heaviness?
Yes, you do. You feel the heaviness, you feel the uncertainty, you feel powerless, right? And I think what we hate in our lives and when we have no control. And the lack of control is something that as humans is very disturbing. And you wish you could do more, but you can't. And you're trying to do the best, and not always the best is the right thing. And you make mistakes, and you wish you could, get on a plane and go visit your kids and visit your family, and you can't. I was joking with my kids the other day. My daughter said, "When was the last time you took a plane?" And I said, "I think it was March the 13th. And she said, "This must be the longest time you've gone in years, not getting on a plane." And I said, "Absolutely right." And, I don't love getting on planes, but my life was doing global health. My work life was traveling. So I tell people I miss my regular life. I miss what I do on a daily basis, but this is what I need to do right now. And this is what I have to do right now.
Dr. Del Rio, why don't we end, since we can't shake hands, and if we were in person, I'd squeeze the life out of you in a hug, but why don't we get out our hand sanitizer?
Yeah, I'll show you my big, I got the big bottle here, right?
Cheers.
And
Cheers.
And I remind people that soap and water is really good, but if you're going to do your hand sanitizer, yes, this is a good way to say goodbye, to part.
Yes.
And why not, put on your mask.
Oh, mine's 5 feet behind me.
And
solidarity.
And we're ready to go, right?
Thank you, Dr. Del Rio. Always a joy to see you, my friend. See you soon. Thank you.
I'll see you soon. Take care.
All right, everybody
Bye.
at home. Stay safe. Stay healthy. Bye.